Welcome back to Made to Be Whole. Stay tuned for part 2 of our wrap-up from this year's MAPS Spring Conference. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. This is Krista. Welcome back. So we talked a little last week about the MAPS conference. I went to the Medical Academy of Pediatrics and Special Needs. And remember from last week, even if you're not pediatric or special needs, all of these principles have broad application to health, especially to chronic health conditions. So I talked about vaccines specifically last week, but I'd like to just dive in a little more to the conference schedule and just give you a teaser of some of the things that I found the most interesting and helpful so that you can explore, send us questions. There's just so much to learn. Like I said before, the more you learn, the more you know you're an idiot, but that's okay. It's better to be aware that you're an idiot. One of the things that I found really, really interesting was the presentation on hyperbaric therapy by Dr. David Dornfeld. So this is a really fascinating doc who's really devoted his practice to this. I think stories are pretty compelling. So I'll share with you a few stories about what hyperbaric's done for people. He had one patient who was a 4-year-old there had been a cold water drowning and she had been underneath water for 15 minutes. Mom pulled her out, did CPR till EMS was able to get there. She was unresponsive. She was still alive. She had a heartbeat, but she was discharged to home with feeding tube, trach, told that there really wasn't much of a chance. This family was pretty tenacious. They found Dr. Dornfeld, who worked with her extensively. When you have these really extensive brain injuries, the longer you're in hyperbaric, the better. So typically in these situations, it's great to get a home soft chamber device and have the person actually sleep in it. But this little girl is actually now fully functioning. She's fantastic. She was given no chance for any quality of life. He had pictures. He shared a little more of the science of it. I know there's been some questions recently in the news about the safety of hyperbaric oxygen. He did address that. He said 2 things to just kind of summarize for you that were unique about that situation. There was a fire and someone died. So that was a hard shell chamber. That only happens in hard shell chambers. But even with the hard shell, safety precautions were not followed. You have to be extremely, extremely careful. And the place where that was done, there have been arrests made because they were not following protocols. You have to do really specific things about how you clean. You can't take in with it like your fleece blanket, anything staticky that could cause electric. But if you're concerned, even if somebody is taking safety precautions, you don't have that same risk with the soft chamber devices, which are generally more affordable. Hyperbaric in the insurance world can be covered for a few very specific things, like non-healing wounds. It's fantastic. Some types of anemia, you can get insurance coverage. But unfortunately, like a lot of very helpful things, it's very difficult to get covered outside of that. You can't, with a prescription, rent home units. There are some facilities that have them. It's actually one of my goals in the next year to be able to get one in the practice because I think could be so beneficial for so many people. He also told a sweet story. He said he doesn't have children. He has his patients and his cats. And he had a 17-year-old cat named Bob who had a stroke and was unable to walk. And so took him to the vet, brought him home, and he started sleeping with Bob in his hyperbaric chamber and showed us videos as Bob progressed to first starting to be able to drag himself again, then to walk again. And then he recovered and had good quality of life for the rest of his his life, which I thought was really sweet. And he had a video. He said, if you can't find Bob, he was following the cat. He would go through the house till he found the chamber and climb in and wait for him because he knew that there was healing there. So hyperbaric is something, there are a lot of studies for brain health, traumatic brain injuries, stroke recovery, autism, dementia, really anything that affects the nervous system. You can have tremendous benefits. And I think it's something worth learning more about that. I'm looking forward to doing some more research. I have a pile of studies right here next to me to get into and find ways to better help our patients. So some of the other things that we covered in the conference, one of them that really stood out to me because, you go, you learn all of this stuff and it's how much can you take home and assimilate into practice because there's just a massive volume of material and our brains can only do so much. But the pattern of neuroinflammation. So basically, when your brain is inflamed, that drives a lot of symptomatology. We talked in previous episodes about PANS, pediatric acute onset neuropsychiatric syndrome, where you have this sudden onset of obsessive compulsive disorder or other psychiatric symptoms driven typically by infection, even though there are a few other possible causes. But I'm very fascinated then, other than treating the infection, because that takes a little time, unfortunately, what can we do to reduce inflammation to help people's quality of life? So there are some things that we can do, first of all, to measure the inflammation. There's some imaging SPECT scans, that's SPECT. SPECT scans are really good at showing us the inflammation. Quinolinic acid is a byproduct that you can find in a urine test called an organic acid test. That is a marker of inflammation. But I think symptoms are our biggest thing. You don't need an expensive test to know that inflammation is driving symptoms. You just need to figure out what you can do to help reduce that. So a couple of different things. We had an episode with Brad White earlier about low-dose naltrexone. Naltrexone can be helpful for reducing that type of inflammation. High DHA fish oils. There are a lot of different types of fish oils or fatty acids, but the higher the DHA content is, the more anti-inflammatory it is. You have things like PEA, curcumin. I've talked before about anti-inflammatory max. It's AI-M. It's Sargentodoxate collis, which is a single ingredient herb that's used a lot in Chinese medicine. Another thing that I sometimes use is Cytoquel from Research Nutritionals. I like that because it has a combination of a bunch of different anti-inflammatory things. But I've already dove into, okay, if I'm home and I'm experiencing increased anxiety, or I see that my kids are, if this is a result of infection causing inflammation, other than continuing to chip away at this infectious process, what can we do? What I've been doing and found to be helpful and encouraging patients to do, do anti-inflammatories around the clock. Now, yes, Advil is an anti-inflammatory and you can take that some, but you don't want to be taking high doses of Advil in perpetuity. That can be problematic for your kidneys, for your gut, that sort of thing. It can be part of a rotation when you're having those symptoms, but rotating, like I personally mostly use the AIM from Dr. Zhang and Cytoquel, and you can take AIM up to 3 times a day. You can take Cytoquel a couple times a day, but it's not a bad experimental thing that you can safely do if you're having increased anxiety and you think it may be related to inflammation. Experiment by doing safe anti-inflammatory things to see if that reduces it. Because if this were a serotonin problem, which is the prevalent theory, really taking curcumin or an herb or an Advil shouldn't have any effect on your anxiety. If you take one of those things and it does have effects, then that helps prove your theory and points you the right direction. Another thing that can really affect the presentation of anxiety and a lot of other neuropsychiatric symptoms is the GABA glutamate balance. So glutamate is excitatory, it's an amino acid, but if you have too much glutamate and too little GABA, you're stuck in that like you're stuck on a loop, fight or flight, just a chronic overexcitation, your brain gets more inflamed. It can be driven by toxins, allergens, all sorts of things, but you've got to find a way to bring that balance down. Obviously, reducing, the glutamate if excess glutamate's an issue, but also increasing GABA. We did mention a few episodes ago, stress maintenance by metabolic maintenance is an excellent example of a GABA supplement that has the proper cofactors. So, in order for GABA to be made, you have to have magnesium and B6. And so, it has magnesium, B6, lemon balm, other things. It's got a great combination of, of stuff, basically. And along with that inflammation, what happens, people will get stuck in fight or flight. So fight or flight, you have these two branches of the nervous system that get talked about a lot. You get your sympathetic nervous system, which is I'm being chased by a bear, and the parasympathetic nervous system, which is chilling out on the couch, reading a book, watching a show, doing whatever. So sympathetic is fight or flight, or really we know now it's fight, flight, or freeze. Some people will run, some people will fight, some people are paralyzed by that. Then you have, on the other hand, the parasympathetic, the rest and digest. You have to have both. Both are important for our survival and our health. But if you have someone who's stuck in fight or flight, they're going to have a lot of chronic health problems. Other than anxiety, you're going to have a lot of digestive problems, because think about it. If you're being chased by that bear, your body doesn't have time to stop and pee and poop and do those other things. So you're going to have people who are constipated, who have loss of appetite, who have just all sorts of dysregulated things going on, because the body still senses danger because it's coming from the inside. So it's really difficult to be calm. I mentioned in the last episode, Elizabeth Booker is non-speaking, but a highly intelligent young woman who has a bachelor's degree and has a nonprofit she's the executive director of called Communication for All. But she spoke last year and this year about heart rate variability. So heart rate variability is a good measure of whether your body is in fight or flight or not. And so she used that data to experiment with herself to find the right things to finally get her body out of that mode. And I think CBD was pretty critical for her in that. But it's interesting, if you become a scientist of self, if you collect data on yourself instead of getting into that catastrophic loop that we sometimes do, because why am I feeling this way? I hate this. I can't live this way. If you're able to calm yourself enough that you can gather data, then you can start doing problem solving and experimenting. And remember, all successful experiments are usually at the tail end of many failures, because failure is just another way of collecting data. You try things, sometimes it doesn't work. You try the next thing, but you don't give up, because there's always, always, always hope. You have never tried everything. It's just refining your data, looking for more information, education, trying new things. So some other things that I found to be really fascinating at this conference. This is the second time that I've heard Dr. Hazen talk. So she is a gut doctor, and she has actually written a book called Let's Talk Shit. And she's really funny. She's really highly intelligent and does a great job breaking this down. Her name's Sabine Hazen, Hazan. You can find the book on Amazon or other places, but it's about disease, digestion, and fecal transplants. But of the many things she does, she has a company called ProgenaBio, which is a type of stool testing that you're actually mapping the microbiome of the gut, which is really far superior than what I've been using up to date, which is the PCR testing of the stool. There's a lot of other companies that do a really good stool analysis that are, breaking down, looking for bacterial overgrowth, yeast, looking for products of maldigestion, some good functional tests. But Progenic Biome is really, really unique because they have been able, by looking at these GI maps where you're actually truly looking at the DNA of that person's gut microbiome, figure out things that are, let's see, consistent patterns for certain disease states. And the nice thing about this is that you can fix it. There's no point in doing an expensive test that you can't do anything about, but there are things that you can do based on this. One thing that she speaks a lot about is bifidobacteria. I mentioned it after she spoke at ILADS in the fall, but bifidobacteria deficiency, for lack of a better term, really is implicated in a lot of different disease states. And what you can do is you can take things to help your body make more bifidobacteria. One of the best ones is bovine immunoglobulin. You want to be careful, again, where that's sourced from. I really like IgG Protect from Orthomolecular. We do have that at our office. There are other ones, but with supplements, just like with medication and everything else, quality is key. It's not always a great deal to save a few bucks because you found something where the label says the same if you don't know that there's high quality control standards from that company, and not just the research and development of the product, but also the production of the product. So low hanging fruit, though, it's not just taking the right probiotics, it's helping your body create the right bacterial balance in your gut. And I have seen, there are some people who say the gut is everything, and I don't think there's anything that's everything. We're a whole body. The gut is certainly a critical, overlooked piece of it, but I am not of the opinion that if you fix your gut, everything's going to be better for everyone, because what messed up the gut in the first place? Okay. So, I have patients whose gut miraculously healed with antibiotics because it was actually an infection that had destroyed their gut. And once they were able to get the right treatment, they were able to quickly rebuild. So don't fall into the pattern of, I don't know, insane perfection where, none of our diets are perfect. They're not going to be. You live on a fallen planet. There's too much processed food. Most of us don't have the time to grow everything organically in our backyard and make it from scratch. Most of us are trying to do the freaking best we can with the resources we have, our biggest resource being time. But we can all do better. So you pick one or two things you can do better about what you're taking in. You make sure, if you are on any antibiotic treatment, that you're aggressively taking good probiotics, and then get a picture of what's going on. This is one of those tests that they've found distinct patterns for neurological conditions like Parkinson's, like Alzheimer's. And she's got a really funny, her family portrait is pictures of everyone in her family's microbiome. But one thing that she always brings up is she and her daughter, theirs looks very similar. And she said she and her daughter are like insanely alike, but their microbiome is very, very similar too. So another fantastic piece of the puzzle, if you go to the Progenibiome website, which is PROGENABIOME.com, you can read about the clinical trials, you can read about the science, the test, all of that sort of thing. But it's really, really fascinating, all of the things that we continue to learn. Our bodies are so complex. Never give up because you've figured out the answer. I mean, if you found something that works for you and you never have health problems again, that's great. That may have been the answer for you, but there's always more looking we can do. There's always more to learn. And I get so excited when I hear people talk who are actual really, really good scientists too. I like science. I may not understand all science, but I really, really like it. I really like digging into the data and understanding that, there was a well-designed study and there's really good data supporting this. And this is something else we can help people do to heal from the inside out instead of just beating them up. Because gut health, I think, is a great example. Yes, there are better and worse foods for your gut. Yes, anti-inflammatory diets are good, but my goodness, I have patients who have are exceptionally disciplined, have the strictest diet, who've cut everything out that could be inflammatory, and they're still really, really sick. We can't beat people up and say, "Oh, you just need to do this, you just need to do that." And sometimes there's pretty low-hanging fruit. I mean, if your diet's made up of pastries and soda and chips, that would be a really good place to start. But there are a lot of people doing the right things who still have messed up guts and are still sick. So let's figure out why. Let's stop beating them up and get some data so then we can give a personalized treatment plan and approach. Because remember, even though good testing is more expensive than we would like it to be, I am a firm believer that good tests save money in the long run because it takes the guesswork out. You're going to pay me or whoever your provider is less because you're not going to be coming back as much because we're going to be able to figure it out more. You're not going to be wasting money on meds, supplements, and treatments that might be good treatments, but might not be the best treatment for you. So just remember that this is complex. You're a complex being. Do not beat yourself up. Last thing about diet is interesting. My daughter, her symptoms, she's 20, so her symptoms began very suddenly when she was about 10. And she went from an uber adventurous eater to like an insanely picky eater with a very bland diet, like rice and beans, shredded wheat, some pasta, hated meat, just hated meat. I remember once she had used to like sloppy joes, and I was worried 'cause she just wasn't getting protein in her diet. She wasn't getting any vegetables. So this was years ago, but one night I made sloppy joes and they had them downstairs outside. We have like a patio off the back. And I'm coming down and I see her coming up holding her plate, which is still has all the meat there. And she's almost crying, going, "It looks like death." But then last night, I really don't make sloppy joes that often, but I made them last night. And she ate two of them and she just looked at me. She said, "Mom, I can eat meat again and it doesn't make me sick anymore." Like something's changed in her body with the treatment of these infections. Something's reset and she's been able to expand her diet because her body is tolerating more things because we treated the underlying cause, which reduced the inflammation and the dysregulation. And then naturally, she's able to eat more. I've found it's interesting with some special needs kids with super restrictive diets. Some of them, there can be a lot of different things that does that, but sometimes it's these kids actually know what their body should and shouldn't have. I had one patient who just did not like anything with protein at all, and I was a little concerned because he was very, very, very restrictive with his diet. But then through some amino acid testing, we figured out there's a genetic disorder that actually he should be on a low protein diet. Like his body is not able to break that down. So this kid was nonverbal, but he intuitively knew what his body needed and didn't need. Now, that being said, if you have a kid who's on a really restricted diet, it's a junk food diet, it's still your job to get the junk food out of the way and give them better options than that. But sometimes a child doesn't eat as much because they're listening to their body and it goes against what we as parents are comfortable with or as adults are comfortable with. Because when you love people, you want to feed them, you want them to be full and happy. And it's really hard to watch a kid restrict themselves, but sometimes they're doing it for therapeutic reasons. So one of the other things that I was super interested in that, again, I'm giving you this as a teaser because I'm not an expert on this. I hope to become much more skilled in it. There are a couple of different presentations and vendors who are talking about plasmalogens. So basically, when you're looking at the nerves, we've talked a lot about the brain and inflammation, but plasmalogens are really, really important for the neurons to function properly. So the synapses are basically, one nerve communicating with another nerve. That's the purpose of the neuron. It's how they pass the signal. So when you have less synaptic function, your neurons shrink and eventually they'll die. And so for a brain to be highly functioning, it has to be active. You've got to have these neurons healthy And they found that high levels of plasmalogens in the synapse are really, really important for nerve function or neuronal function specifically to be optimal. And they've found reduced levels of plasmalogens in the brain synapses in patients with dementia and other neurological conditions. So there are a couple of different companies doing cool things and cool research with plasmalogens. Dr. Goodenow, Dayan Goodenow is his name, Dayan Goodenow. He has a company called Prodrome Science. They do some oral plasmalogen precursors that you can take. I've actually ordered some of these to try on a few people in my family. There are some things we can do IV that I'm looking at getting more training for. But this makes a lot of sense to me intuitively, which is why I'm adding it to the things that I want to learn about when I look at patients with neurological, neuropsychiatric symptoms, because psychiatric symptoms are neurological symptoms. Like emotions aren't a nebulous out there thing. It's because of neurological function being disrupted by any number of things. But this makes sense when I see the presentations of people with these severe symptoms that their nerves are not communicating. Like the signal is not getting passed. They can't get their body to do what it's supposed to do. But if we can improve the network, if we can get everything communicating properly, that there can be a lot of improvement. In one of the case studies that he brought up, you were looking at significant improvement over a 9-month period. This takes time. You are rebuilding a new, healthier brain, new, healthier infrastructure. Think how long it takes to fix the interstate in your town. It's probably been under construction for most of your life. So when it comes to things like this and rebuilding, for most people, it's not going to be like, oh, I took it for a few weeks and my life changed, even though, yeah, I mean, it's always possible you can start to see improvements. But when you're looking at true healing and you're looking at getting people better and staying better, it's going to take time. So having patience is really difficult when someone's really sick, but it's important. If you have specific things you would like me to speak in more depth about or cover more, I would be thrilled to answer those questions. You can text or call the podcast line, the numbers at the end of the show. I'd be happy to dig in more. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.